Okay. Good afternoon, everybody. My name is Brendan Casey. I'm the manager of the Connected Health and Wellbeing Cluster, and you're very welcome to today's webinar. So we've a 30-minute session. There's a few more people to join us as well, but we'll kick off in a second. I'm just going to do some brief intros. And we've also Michael O'Neill of Screen Clinical will be joining us as well. So as I said, I'm Brendan Casey. I'm manager of the Connected Health and Wellbeing Cluster. I'm based in Dundalk Institute of Technology, and myself and Brendan Crossy are the lead partners in the AI for Health program. So Brendan's going to give an overview of the AI for Health program, what's involved in the application, what's involved in the actual program. This is our third iteration of it, but it's changed every time, and this one has the most supports. And you'll also see Gwen Conlon there, who's my colleague here at DKIT, who's the community manager of the DConnect Digital Health Hub. So I know there's a few cluster members, there's a few other people here, and we expect one or two more. So in the interest of time, we are going to try to keep it to the 30 minutes. So as I said, Brendan will speak for probably about 10 or 15 minutes on the actual program. And then I'll have a short session with Michael O'Neill from Screen Clinical, who's participated. There will be an opportunity for some questions and answers at the end of that as well. You can also put in the chat. And to be honest, if time permitting, if you have any specific questions, even as Brendan's presenting, feel free to jump in or stick up your hand, and we'll, if time permits, we'll answer them as we're going along and have a little bit more interaction. So with that, Brendan, I'll pass over to you.
Thanks, Brendan. Yeah, so as Brendan said, I quickly go through what the program is, a little bit of history of where we've come from and how we've built this over the last 2 to 3 phases of the program. We'll look at the structure of the program and the timelines associated with it, and then give you an overview of who should apply and the process to apply and the process for onboarding. And then I'll hand over to Brendan then to have this conversation with Michael. Okay, so basically it's a comprehensive program to support entrepreneurs, clinicians, tech companies across Ireland who've got an idea for a health tech solution. And really we take you through right from the start, right from the conception of your idea, right through to delivery and building of your service, your digital platform, whether that's a mobile app, whether that's a web app, whether it's both. And really what we're looking to do is bring together technology, AI, and to solve real health tech problems there. So it's a really hands-on support program. It's just not theory. We do have some workshops in there to support you on your journey. But essentially it's there to bridge that innovation, bridge that from your idea right through to a market-ready solution into the marketplace. The program is 100% supported by Intertrade Ireland, so thanks to our sponsors for funding this. But we're also supported by the DConnect team in the Dundalk Institute of Technology, the Connected Health and Wellbeing Cluster, ourselves as the delivery agent, and then for support, then we have some healthcare advisors from the Pillar Centre for Transformational Healthcare and Tala Hospital in Dublin, and MOIC as the Medicines Optimisation Centre in Northern Ireland.
So, Brendan, you meant to be sharing slides at the moment? Oh no.
Yes.
We can't see them. Apologies. I know.
Just that again.
Now we can see your presenter mode as well if you just put that into.
See that now?
Yeah, and the good news is we're already halfway through the slides, Brendan.
Yeah, and so as Brendan said, this is phase 3 of the program. So it started for us 2 years ago, where AI was just coming into the marketplace, and we delivered an educational program to educate people within the sector on the opportunities afforded by AI within healthcare. Last year, we built on that by actually taking people through a journey of taking ideas to build them wireframes, and we basically started with an ideation session to hone in their ideas and make sure that was a viable proposition for the market. We looked at the commercialization of that, and then we built them wireframes for them to showcase that to their internal teams, their funders, and then clickable prototypes so that they can actually demonstrate it to potential customers. The great news was that out of 11 companies, 7 or 8 of them went out there and built their own solutions, including Michael. But unfortunately, 30% of the companies didn't have the funding to take that into the marketplace, and had some really great ideas. So that's when we went back into trade and said, we think there's real potential for this, but we need to be able to cover and bring people the full way through that journey and actually building those products and services that they can take to the marketplace. So that's where phase 3 has come out of now, where we actually take in that full journey to deliver you a fully working commercial solution. So we had great feedback from the last one. In phase 2, 100% of the participants said that they would recommend the program, and hopefully with phase 3 we can actually take that forward and really give real benefits back to the participants. So who should apply? Who's this built for? It's basically built for anyone who's got an idea for a health tech solution and they want to bring it to market. So the real focus here is in bringing solutions to market. But they can come from whatever background and whatever level of expertise. The last time our cohort had real mixture of people who were single person companies with no technology experience, right through to companies who've been going for, like Michael, for 10, 15 years, who had their own technical teams. So we were able to help all those and really added value to all those people. So basically, it's for anyone who's got an idea. What does it offer? As I said, it's now a 100% funded program. There's no cost to the organization. We will support you in that journey right through from your idea to actually building your full web and mobile app. We'll give you hands-on mentoring to take you in that journey. We have a number of workshops and masterclasses to support you in that journey, and been able to give you some expertise and guidance around the clinical and regulatory journey you have to go through as well. So the questions we're sort of asked for are, what level of expertise? You don't need any expertise. I said there's no cost. You can start at any stage of that journey. So right from the idea, but you could come along and you maybe have a prototype developed or a wireframe developed, and you need to build that into a full service. We're here to support you. The program is run over 2 phases of 6 participants in each stage. The first phase will start in December of this year, and both individuals and existing companies are welcome. But you must be health tech related, and you must utilize AI in the solution. There is 2 mandatory workshops that you need to attend, and you will have to complete a declaration for your de minimis. These are just regulations that Intertrade have to follow. How to apply? It's really simple. All the information is on the website, and we'll put a copy of this webinar up there as well. So for Northern Ireland-based companies, it's .co.uk, aonhealthcare.co.uk. For Republic of Ireland companies, it's aonhealthcare.ie. You basically download the Word application form that's on the website, and it's a very short form. Basically, just ask for your ideas, complete as much as that you can. If you need any help or guidance, please contact me, and we'll be able to help and assist you. But you need to get your proposals submitted on the website by the 20th of November. So that's end of day, 20th of November. We will quickly review those and come back to you by the 12th of December to notify you to start. And we'd really like to start the initial ideation session, which will be a half day in Dundalk, sometime in mid to end So it will be mid-December. The program is there to support you going forward as well, because we would encourage you then to join the cluster. It's run by Brandon and his team. As part of the help on the workshops, we will give you connections to investors. We'll help you with the clinical support, and we're also then working, with some experts on giving you support on international market entry, and we want to create an online network because we've probably got 40 companies in that at the moment. Just hand over to Brandon then.
Apologies, I'm muted. So thanks very much, Brendan. I think Michael has just joined us. Michael, can you turn your camera on there?
Yeah, sure. Didn't want to.
And so look, what time's there? 12:43. So we've a little bit of time. So before I take any questions, I think Michael, you just still have to go on.
What's that? Sorry, Brendan, you want me to go?
I think you just need to put your camera on there, Michael.
My camera's on.
Oh, there we are now. We see you now.
Right.
Yes. So you're very well, Michael. So look, you went through the second iteration of the AI for Health program, your company based in Derry. I know AI was new to you. So really just like in a couple of minutes, you might just give a bit of a background around Screen Clinical, what you do, and I suppose what piqued your interest in looking at AI.
Yeah. Thanks, Brendan. I'm sorry about the IT. Like, I suppose it's ironic that happened in a meeting like this, but so thanks for sorting that for me. I just wanted to say hello to everybody, and Brendan asked me just to share, I suppose, our experiences at Screen Clinical and the AI and healthcare journey. And look, I suppose overall it's been a fantastic program for us, and I would certainly encourage it. I'm a pharmacist myself, and we're pharmacists. Screen Clinical have a team of pharmacists who go around to deliver therapy review services, mostly around chronic disease management and GP practices, mostly across the UK, GB in Northern Ireland. And we've also expanded into the Republic of Ireland as well. As you can see, we're our banner there. We're 10 years in business last week. So as well as we have been doing the day job, and I suppose that's one of the real benefits of this program, that we've been able to innovate and develop solutions that we badly needed, while still getting on with the day job. I think that's a real testament to the program and the people involved in it. So, very, very briefly, what we do is we extract and process information within GP practices around a specific chronic disease area. I think there's 80% of patient consultations in the NHS take place in GP practices, so there's 80% of the data sets there, at least. So it gives you an idea of the scale of the data sets that we're processing to drill down into, and it's very granular what we do, given the restrictions of data sharing and the IT systems capabilities. So basically, we knew we needed to develop technical solutions and IT solutions to make it more operationally efficient and to I suppose more effective in terms of patient outcomes, and the outcomes to drive efficiencies or help the under pressure healthcare systems deliver efficiencies and more more efficient ways of working. So we have no technical background. We are just a team of pharmacists and support staff with no technical ability or no technical capabilities within the company when we at the start of this program. And I suppose we knew that with AI becoming such a so relevant everything we do, we wanted to look at those solutions as well. So between lack of technical capabilities and lack of experience and AI, we really didn't know where to start, and the opportunity arose to go on the program. And must say, in terms of overall, it's been a real help in removing the barriers, both technical and in terms of ethic and legalities. There's been great insight into that. sort of the initial part of it, the program was an ideation session, sat down with Brenton and Brendan, and it was Kira, wasn't she? That session, and I suppose, look, anything you, for my experience, anything you ever involved in, it's the people that are most important. And I must say that the team was just so. The ideation session just was a great sort of opportunity to get our ideas out down on paper and discuss openly what was possible and what was legal, for want of a better term. And the guys really took a time to get to know our business, get to know how we worked, and to piece everything together for us and be able to offer potential solutions, what could be done, what couldn't be done, or how we would sort of overcome barriers. And it really did sort of, the ideation session really did sort of bring our ideas and aspirations to life, and it was a real sort of reassurance to know what we were thinking along the lines, or had a vision that was realizable, and that we can hopefully sort of really bring to life and commercialize it.
Yeah, I suppose that's, so it's a mixture. The program, as you said there, Michael, it's a mixture between that initial ideation session where you're sort of exploring, obviously, your idea, but it's getting a bit of feedback on what you want to do. I think it's also exploring other opportunities, because the problem is, for a lot of the people, first of all, they won't know exactly what they want to do, and then they won't know what opportunities are out there from a technical perspective. And I think that's really important. So we get that right on the one-to-one basis. But then as we're going through the individual days, where you've got a cohort of 6 companies in this instance, most people are on a similar journey. There'll be varying levels of skills, so some people will have more technical skills, some people will have more around data management. You guys were in a lucky position that you actually had the data, which is a really important part, because I think most of the participants, they'll get sick of us talking about data, but it's such a crucial part of AI. But you actually had the data. It was how do you manage it, and how do you get that sort of operational efficiency? And I think that's another important part, because look, a number of the participants will be, customer facing, and it's how customers will use AI. But equally, it's around, you said it there, it's around actually having to improve your operational efficiency, to improve patient outcomes. And, it's all equally valid, and to support us there as part of the program. And I suppose after the ideation session, we worked on a feasibility report with you, and that sort of outlined a couple of solutions. It outlined, potential. Can you just maybe go through the stage after you got the feasibility report on Screen Clinical? And as I said, it outlined some options and some potential costs. Not so much cost, because there was no cost, but the potential market opportunities and some potential technical. How was that phase between the feasibility report and between creating the wireframe solution, or having the wireframe solution? What was involved in that? And I know in particular, obviously, you would have done a lot of work with Brandon, and as he said, the likes of Kira would have helped on some of the data regulations and other sort of regulatory aspects. But can you describe that process, I suppose? And I know you had another team member with you as well, Connell. But if you might just describe, because it was probably around about 2 months, I'd say, at least, between the wireframe and the initial feasibility report.
Yeah, the feasibility report was it's a really sort of meaty document that again brought our ideas to life, and really sort of started the innovation journey for real. And then the wireframe was, so I suppose we discussed the initial feasibility report and sort of drilled down onto it to see how that would lead to the wireframe, and then sort of pushed back, and we engaged with Brenton at that stage to actually deliver to create the wireframe from the technical aspect of it. And again, that was sort of a really sort of seamless and collaborative process, and did take care of, we learned a lot through that process about what a solution, how it would work, what it might look like, a sort of in terms of, sort of the real feel for the customers, that the platform, it'll be a web-based platform that, and we get a sort of real feel for how customers would use it and what they thought of it. And it was and any of the regulatory sort of I suppose for us to do this at scale, we will need to sort of we'll have to host you'll have to work on the cloud, and that is a massive piece for us in terms of regulatory and ethics. And there's a lot of, it was really, really helpful that we were able to, with the time and the support to work that out, and the sort of the expertise and the patience of Kira in particular. And that's not, and I say the bringing Brenton did a fantastic job, and developing the wireframe to sort of specification, or to look and a feel that we were comfortable with. And there's regular collaboration there. And well, you mentioned Conan there. While we had no IT sort of in-house capabilities, that outside of this project, we brought Conan on board, and he's been I think a real support to us internally, and hopefully, and I think to Brenton as well. And it's been a real sort of knowledge transfer as well throughout the Conan has learned a huge amount from it, and could create experience and support from Brenton, and help him to develop it as well. So, and the wireframe's been really, really useful in terms of it's been a great tool for sort of market access, or testing the market and talking to our sort of customers, both sort of at a practice level, more strategic level. So the wireframe is it was a real learning curve for us, but it was, a massive step forward, and it happened. It was done very efficiently, and this really felt supported on that journey. And I think Brandon, you're maybe downplaying the sort of the cost of it. Obviously, there's no cost to us, but it was I suppose the program and overall, it would scare me to think what we would have to pay for the expertise and the time that we've been afforded throughout the program, and that's right across sort of the three of you and Kieran and whoever else has been involved, and it's been it's been just.
And I think that's an important part, though. Yeah, I appreciate that. And actually, I suppose the big difference between the program that you are on, Michael, and this one is that we take it a step further. So now we still do the wireframe. I think for people who maybe non-technical, it's sort of a digital iteration of what your final product or service would look like. But actually, in this program, we've got more hands-on support. So after we create the feasibility report and the wireframe, we'll actually work directly on your product or service or platform, whatever it is. So there's a subsequent area of support as part of this program. And the reason we've done that, as Brendan said, is because there was a gap that not everybody had the expertise, or in some cases they may not have the funding. So thanks to Intertrade Ireland, we have that, and there is an extra step. And the other thing that you mentioned there that's quite interesting, Michael, was just, and we've seen it from other participants as well, is sometimes it just needs that bit of extra focus, and it's having that sort of framework that you've committed to doing this, and you'll have that AI solution, whether it's in 3 months or 6 months, that you have the support. So instead of putting in the long finger, to be honest, I think a lot of the participants said it actually just focused our minds. We knew we had to do this, and it gave us the support. Just before I take some final Q&As, Michael, do you just want to explain? I know you're still going through the final process of what your AI solution, but essentially it's moving away from the old Excel system that you had and having it a sort of AI solution. Do you want to give a short overview of what that AI solution, AI sort of driven process is?
Yeah, well, and a quick summary of what a project looks like for us at the minute, as we probably take typically between half a day and a day running searches on GP systems and processing the data on those reasonably competent sort of Excel workbooks that you can slice and dice the information, but and identify patient cohorts that need intervention, potentially need intervention. We're hoping to improve. Well, we're very close to developing a solution that will reduce that significantly. That we're probably maybe reducing that by the time involved in that by about 80%, and that's just sort of the technical part of the process. Then once we identify patient cohorts, we have to basically go through their notes and screen them and assess whether they're suitable for any proposed interventions or what they might need. And the plan, what we're currently developing is this sort of overlay. So once we have the patient data set, we can overlay the sort of clinical guidelines, national guidelines on it, and treatment guidelines on those patient data sets to be able to generate treatment recommendations for patients. And that brings it to hopefully a whole different level in market that we can sort of develop a product that will deliver this at scale, and that obviously then improves patient outcomes, improves healthcare or health systems outcomes.
So it's a huge support, I suppose, into wider population health and analysing the data. And I think some of the predictive solutions as well. I think, that you can be more proactive rather than, having to, I suppose, see trends, and using AI for the data analysis. So, okay, guys, it's 12:56, so we've 4 minutes. Here we go. Does anybody have any particular questions? Look, you can, and I can take that, Lord. Go ahead. Do we have to? I think you might have to. Gwen, do we have to unmute, Lord?
Let me see. I'll see if I can.
And people were asking for the details of where to get in touch, where to apply for. So just put up there the websites.
Yeah. Oh, sorry. I think, Lord, we should be able to hear you there if you want to go ahead and ask a question.
Okay. Hi, everyone. Brendan and the team, I just want to say a very big thank you to all, like you have said again, your time, dedication, commitment, and also the knowledge transfer. If there is anybody here who is wondering or doubting themselves on how to start, whether the idea is good or if it can work, I had the opportunity to join the ideation session with Norma, who is on the program, and it was an eye-opener for me. It was a light bulb moment. I was really not sure what we were talking about at the time, but when Brendan listened to us and the team listened to us, and they went back, and by the time we received the market research report, it was that light bulb moment for me. It was like, wow. Then I started even understanding more and more what Norma was talking about and what the project was about. And it also gave me the chance to believe in myself and my dream to say, okay, AI is not, I don't need AI education or certificates to be able to do this thing. So I would encourage anyone who is wanting to apply to please go ahead, because Brendan and the team will give you all the necessary education and training and knowledge you need to make the work a bit more easy for you. So once again, on behalf of myself and Norma, Brendan and the team, want to say a very big thank you to all of you.
No, thanks, and we thank you very much for that, Lord. I didn't know you were going to be attending, so I appreciate that. And look, going back to what Brendan mentioned earlier on,
I can't wait.
God. And this is open to applicants, right across, from one-person operators right through to large companies, and even clinicians and researchers that have a commercial idea, I suppose, and that they want to commercialize, because I think part of this, and I think Lord and Michael will agree, part of it is about the group that you get and how they support each other and how they interact with each other over the 4 or 5 months or so as well. Does anybody else have any questions? I know just 12:59. I don't see any hands up, but speak up. Well, actually, I don't think you can speak up, so you might have to stick your hand up.
I did allow the mics there, so everyone should be able to, if they want to, they can unmute. So
okay, Emo, go ahead, Diane. Go ahead, Emo, if you want to just speak up.
Oh, yes. Sorry, just unmuting the mic there. Thanks very much for the information. In terms of time commitment, I might have missed that session or that information at the start, but what is it in terms of time commitment?
So I suppose from a practical perspective, The first session is roughly half day or 2 to 3 hours where we do the ideation session, and that will happen, just before Christmas, and maybe for one or two, it might be just after Christmas. After that, Emo, there's 4 full day sessions either in DKIT or another location, and they're generally one a month. So you're talking January, February, March, April, 1 full day per month. But there is quite a bit of interaction, obviously, because we're producing a feasibility report, because we're producing the wireframe, because we're producing an actual, finished product or service with you. There'd be there's a few hours each week at least, where you're probably meeting Brendan virtually. It won't be in person, but there's a commitment there, because otherwise we won't be able to deliver on your potential. But the face-to-face is sort of 4 full days, so roughly 1 day a month.
1 day a month. Okay. And then obviously a couple of hours a week minimum.
Yes. Yeah.
Okay.
Is that right, Brendan? It should be the same. Maybe towards the end, Brendan, probably still roughly, even when you're moving from the wireframe to the actual full product development, it's still a couple of hours a week, I suppose, 2 hours a week, would you think?
A couple hours a week. But again, the more you put in, the more you get out of it as well.
Of course. Yeah, of course. And maybe we can connect after this just to talk a little bit more. And Michael, just you were doing your day-to-day as well as you did the program, and that worked out okay?
You're muted there, Michael.
You need to unmute, Michael. I'll see if I can unmute you there.
Yeah, you okay then? Right? Go ahead, Michael.
Yeah, it was fine. Yeah, it was manageable.
Perfect.
It wasn't. Yeah.
Look, we'll send through the slides directly after this as well, Ema, so you'll have, I think, the information there on the days is in there. We'll send that directly out, and this video will be recorded on the website as well. Not that you like to listen to Michael again, but maybe not me, But any other questions? We've just gone slightly over time, but we're happy to take a question if there's anybody else.
If you do have any questions, do you have any queries, please drop me a line, give me a call. More than happy to talk through people's projects, help you scope it out a little bit, help you with the application form, just whatever you need to help you through there. We're here to get some really great ideas and take them to market, so we're here to help. So we want as many people to apply as possible.
Yeah, we've another question from Ola there, and I suppose I know just before I ask you, Ola, I think Brendan, you explained that they have to download a Word document and then they upload it. Yeah. I'm too sure.
Yeah, I just want to check. Is there a difference between going through the Northern Ireland or the Republic of Ireland website? And is there a limited places, say, from Northern Ireland and limited places for the South, or is it just the one pot?
It's just the
one pot, but we want companies across both jurisdictions, so we have to have at least one from each side. But it's really down to the quality of the applications. Also, want to say is that although we're starting here in December, we will be taking on another 6 projects on in 6 months' time. So
I'm muted as well. Apologies. Sorry, there's a question there. I'm not too sure what's happening with our teams now. We're getting a bit of
yeah, it's weird because Brendan's just been muted there too. I can hear myself in an echo.
Okay.
welcome
Sean, I'm not too sure what's happening there now. Nobody else is an issue, but I'll send you on the document directly. Too sure how this has happened. Okay. Any other final questions?
Sean, I would say if you have any problems, just email it to me, and we'll accept it. So if the website's not working, just email it to us. That's acceptable.
See. I'll actually put in the application directly into this link as well. I can send that on afterwards.
I just muted everybody there, so hopefully that's changed the sound
Okay,
reverb.
yes, that's probably what it was. Yes,
Yeah.
actually, yeah.
So yeah, so the website just, it seems to be back again. It seemed to have gone a couple of times during the call there, but maybe there was a lot of people trying to get on. I don't know, but it definitely, as it seems to be back again now. So it was intermittent. So, but we can definitely send out the links anyway afterwards.
Okay. Any other final questions?
Just put my email address in the chat if anyone wants to contact me directly.
Yeah, no, as I said, I'll stick it into the chat here as well. People will be able to see, but we'll send it out. Gwen, you'll be sending out the slides
Yeah,
anyway.
exactly.
So
Yeah, we'll pop the links
documents.
for everything and the link to directly apply as well.
Yeah. Okay, we can even download the Word document and send it out as well.
Yeah, exactly.
Okay, guys. I think all you've already asked. I think that's just your hand up still. So probably going into your lunch period now. So thanks very much for attending. As I said, just contact myself, Brandon, Gwen, and Michael. Thanks for your input, and Lord as well. And we look forward to seeing your applications. And the 28th, so Friday week is the deadline. So I suppose that's the thing and we should be back to you, just a week after that as well. So, okay. All right.
Thank you
Thanks,
very
everybody.
much. Look
Thanks,
forward to
guys.
working with you.
Thanks, guys. Bye.